After my son started getting interest in Lego. Lego became almost an obsession, and then I realized, hey, this is something that I can do by myself, and there's connections with doing research. It starts with building something that was meant to be built in a certain way, but if I do it a bit differently, then I might get something that is maybe better. My name is Myriam Chalabi. I'm a medical oncologist here at the Netherlands Cancer Institute. I have been here since 2014, first for my training for 2 years, and then I stayed as a staff member and have been here ever since. Next to being a medical oncologist doing clinical work, seeing patients, I do clinical research, translational research, and my research focuses on immunotherapy, and then specifically neoadjuvant immunotherapy. I was born in Lebanon. When I was about 5.5, we left Lebanon and went to Curacao. And I studied there until I was 17, finished high school, and then came to the Netherlands to study medicine. I knew that I wanted to become an oncologist. I wanted to help people. I love working with patients. I love seeing my patients. It's something that I would never want to give up, because ultimately that's what I'm doing my research for. It's not for the sake of doing research. It's ultimately to improve these patients' outcomes. When thinking about the challenges that we face in oncology, that so many patients don't respond to certain treatments, that we haven't improved treatments for specific populations in almost 20 years, that is something that I couldn't just sit on and accept. I was seeing the results that were coming out of research with immunotherapy in patients with colorectal cancer. The results were disappointing. Immunotherapy was working for a very small proportion of patients, but it wasn't for the vast majority of those patients. And I wanted to do something to establish new treatment possibilities, never really thinking that it would lead to what it led to, that we actually change paradigms and that we change the way these patients are treated. The MMR proficient colon cancers, we knew that in earlier stages of the disease, these tumors were probably more immunogenic. They could be more likely to respond to immunotherapy. The idea was to learn from their tumors. What happens after you give immunotherapy? What can we understand from what's happening in the tumor to ultimately improve treatment outcomes? Expectation management is very important because there's always going to be challenges. But I also felt that if you don't do this type of high-risk research, then we're not going to move forward. Innovation means going the extra mile, daring to do things that others have not done before, as long as you have a good rationale to be doing things differently. It's not just, doing something different because you want to be different, but doing things different because you have a good reason to do so. My hopes would be that we can pinpoint patients that we can treat very well with immunotherapy. That's already improvement over 20 years of standard of care. This was a very, very joint effort. I was very lucky to have people from all across the disciplines standing with me in terms of the science. You need people around you that are supportive. You need people that have done the work before, and that's the way to move forward. You cannot do it alone. This recognition hopefully will help us to initiate more clinical trials, more translational research to understanding the biology even better and to improving outcomes even more in the future. It's actually crazy to think that as a 5-year-old, being born in a country where I know that if I had stayed there, that things would have turned out very differently for me. And then sitting here at this desk and doing the work that I do and encountering the results that I have encountered, the people that I have encountered. It's cool to think that, I made it and I'm here. Doing science it's not easy. You have to overcome a lot of challenges. But if you're sure about the work that you're doing and if you stand behind it, if that's something that you're passionate about, then you should go for it. Treating patients and improving their outcomes is what inspires me. My name is Myriam Chalabi, and I push scientific boundaries by thinking outside of the box.